I lost my father-in-law, Ron, to suicide on December 23rd, 2016. He was only 66 years old.
My son, Paul, he was 19 years old, and he died on March 31st of 2015.
The impacts of suicide in our family is sadly too far stretching. We lost my uncle first to suicide, and a year later, on May 13th, 1999, we lost my 16-year-old brother, Caleb, to suicide. This last January, we lost my 27-year-old cousin to suicide.
The shock was overwhelming, and I wouldn't want anyone to go through that.
It is hard to talk about. I can remember some of his friends saying they thought it was an April Fool's joke when they got the news. And it was just heart-wrenching to have to talk to everybody and just calling on my family and my friends. And I couldn't believe it.
Trying to summarize the impacts that it has on a family is very difficult. You have all of the could-haves, would-haves, should-haves, wish we had known, how did this happen again? It's just a hard thing to kind of process. In every family event, you miss them, and even though for some it's been decades, the pain of their loss is still here.
I've just been missing being his mom. And I know I'm still his mom. I'll always be his mom, but I can't be his mom. I'm not his mom in the present. I can't think about his future. I can't help him make decisions. I just miss being his mom.
We need to look at mental health conditions the same way that we look at other physical illnesses.
Suicide does not discriminate. It can happen to anyone. Some of the risk factors for suicide include history of depression and other mental health disorders, history of substance use disorders, family history of suicide, history of trauma or abuse, easy access to lethal methods, exposure to others who have died by suicide, such as in the news, serious physical illness, and barriers to accessing mental health treatment.
Few of the stigmas that we hear and we may come across are that those who are living with mental health conditions are lacking self-discipline or doesn't have the willpower. This thought process is not only flawed, but it also prevents an individual from reaching out for help and seeking timely treatments.
The Crisis Intervention Team, also known as CIT, is a 40-hour specialized training course that officers go through that hones in on your active listening skills and provides the officer an opportunity to become more familiar with some of the mental health crises that are out there. Officers respond to calls of people in mental health crisis daily, and just know that if you make that call, the officer that's responding to help you out will arrive and do the best they can, showing you empathy, compassion, and utilizing any resources that they have available to them to help you in the short-term situation and also long-term.
My role here at the Bloomington Police Department is to follow up on the referrals that I get from the police officers who respond to calls involving mental health and/or substance use disorders. This is a partnership between the law enforcement officers and the social service agencies to come together and to better serve our communities.
One thing we do as public health nurses, we go into their homes, but we are assessing not only their environment, but just how they are, how they're feeling, how is their mental health.
The partnerships and the layers of resources that are in place are critical because everyone has their own role.
What I want people in the community to know about suicide is that it doesn't have a set narrative. For some people, they struggle with suicidal thoughts their entire lives. For others, it's a season of depression. And for others, like my brother, I believe he thought it was a quick solution to a temporary feeling or problem. I don't think he realized that his choice was a life-ending decision. I want people in the community to know that there are solutions and that people care about them.
I think the most important thing is that it's okay to talk about suicide. When Paul died, I had more than one person say, we shouldn't talk about the way Paul died. And I was so confused because it's like, if we don't talk about it, how are people going to know what the warning signs are? How are they going to know what resources are available? How are they going to be able to cope going forward?
So when we talk about suicide survivors, we're talking about the whole group of people who have been left behind by this person's death. And that includes family, friends, neighbors, coworkers, anyone who has lost a loved one. So it's important to know that the suicide doesn't just end with that one person, but it affects a whole network of people who really loved and cared for that person.